I'm Tanya Bravender.
Catherine Robbins.
And Lauren Fish.
Welcome. We are here today to put a spotlight on nutrition, exercise, and cancer. We all know that diet and exercise are touted as primary cancer preventions, but current research, meta-analysis, suggests that the same lifestyle changes can actually influence whether cancer survivors will stay in remission or have recurrences.
Wow.
Yeah, isn't that crazy?
Yeah.
So at least 20 prospective observational studies have shown that physical active cancer survivors have a lower risk of cancer recurrences and improved survival compared to those who are inactive. It's pretty good.
Yeah.
Diet changes show the same results. A random controlled trial of 2,437 postmenopausal women in remission from breast cancer changed their diets to only include 20% fat. This led to a 24% reduction in new breast cancer events for the group.
Incredible.
I know, that's awesome. So for those cancer survivors out there, or for those of you who love them, these are the current grade A guidelines recommendations for diet and exercise after cancer.
Thank you, Tanya.
Yeah, Catherine?
So these following guidelines were published by Joanna Briggs Institute. So many cancer survivors are at a higher risk for heart disease. So it is recommended that those in remission follow a heart-healthy diet, as recommended by the American Heart Association and the Institute of Medicine, which suggests that 20 to 35% of daily calories come from unsaturated healthy fats. Omega-3 fatty acids specifically are correlated with a lower overall mortality and reduces the risk of cardiovascular disease.
Omega acids, those come from like fish and stuff, right? Okay, yeah.
In addition, a recommendation of 1.5 to 2 cups of fruit and 2 to 3 cups of vegetables should be included in a healthy post-treatment diet. Both articles reference the importance of protein intake both during and after chemotherapy of 0.8 grams per kilogram.
Okay.
It is especially important for those clients that wish to take supplements to meet their needs, to meet with a dietitian or a certified oncology specialist.
Okay. Sense, yeah.
Needs must be determined by a registered dietitian, since emerging data suggests higher nutritional intake from non-food sources can be detrimental. It is necessary for them to assess their intake so that recommended amounts of supplements is not exceeded. For those patients that chronically do not meet their 2/3 of their needs, homemade or store-bought prepared supplemental drinks are recommended since the caloric needs of these patients is compromised. And alcohol consumption. A conflicting topic in cancer guidelines.
Yeah, that's for sure.
It's a main risk for the development of some primary cancers. And this is one of the places where individual needs need to be assessed before advisement. And for those clients who already have a diagnosis of cancer, it is thought that the consumption of alcohol will increase the risk of secondary cancer development.
That's not good.
Okay. Well, thank you, Catherine. Cancer survivors in treatment that have immunosuppression need to be even more cautious about food safety to prevent infection.
Yeah, that makes sense.
This includes standard practices such as washing your hands, proper food handling, and that goes from preparation all the way down to storage. As well, it's important for clients to avoid unpasteurized foods, including honey, which I know is sad for some of us. And when eating in restaurants, you need to avoid foods that have possible contaminations. That includes sushi and salad bars.
That's a sad day for me.
Yeah, water purity should also be considered, so you might want to stay away from tap water. Weight is a particular concern for cancer patients. Cancer patients that are underweight and malnourished have a higher incidence of complications during treatment. Consuming enough calories is essential for patients who want to maintain weight for those that are already malnourished, so this can be pretty difficult. So dietary intake should be carefully assessed. A review of multi-dimensional rehabilitation programs for adult cancer survivors, published in 2016 and found in the Cochrane Library, indicated that patients commonly experience weight gain, decreased muscle tone, and fatigue during remission. So you've already gone through this horrible experience and you still don't feel like yourself. It can be really hard. According to the guidelines, obesity has been shown to increase the recurrence of cancer. Avoiding weight gain is important for survivors that are normal weight, and intentional weight loss following recovery among those that are overweight is associated with a lot of health benefits. Cochrane article found that the physical needs are more easily met than the psychosocial needs, which kind of makes sense. It's pretty complicated. So it's helpful for patients to focus on one area of improvement than to have a multidimensional approach.
Okay. Well, one of those focus areas could be exercise, which is important to recovery.
Absolutely.
On survivors, they're tired and whatnot. Even a little activity though has shown to create a lot of benefits, but always there's factors to keep into consideration. Like those who are anemic should probably postpone starting a new exercise regime until cleared by their physician. And if you're still immunocompromised or immunosuppressed, public gyms and pools probably should be avoided. And fatigue is a common complaint of survivors, so when they start activity, they need to start light and only increase when well tolerated. So,
Great.
yeah, I know, I love it.
Well, thank you all for tuning in. We'll be back next week with another special report.
Have a good night.